You cannot look at someone and tell if they have the coronavirus. And that's the problem. I sat down with Medical Director of Infectious Diseases, Dr. John Bradley from Rady Children's Hospital, and he talks Halloween, the upcoming holiday season, kids going back to school, and what you can do to protect your family. The first thing that I want to talk about, because I know it's on the mind of parents, it's on our news, it's on the mind of the kids right now. Everybody's talking about the schools that have reopened, the schools that are slowly starting to reopen, and the schools that have not opened. Where are we at with COVID and schools right now in San Diego?
Okay, great question. And I know a lot of people are really worried. But in fact, if you look at all of our discussions over the past few months and the discussions that healthcare providers and people who work in infectious disease are sharing with the county and the supervisors and the school board, it's been very consistent. We know how the virus spreads, and largely we know how we can stop it from spreading. So wearing masks, and by the way, to anyone looking at this, I am at the very end of a long table. You're at least 10 to 12 feet away from me, so I'm not putting anyone at risk. And I promise not to sneeze or cough, because that projects particles. But back to the schools. Masking helps. No question, every week there's more scientific information that comes out that says that masks both prevent you from spreading and prevent you from picking it up. And the experience in Europe is that even these little kids, if they see everyone else wearing masks, they just wear masks. It's like, well, this is normal. So in a compliant society where everyone's doing it, the kids just follow the example of their parents and older siblings. So masking, distancing, the farther apart you are, the safer you are. And so we've talked about 6 feet being the best for droplet transmission, and if you can get 6 feet, that's perfect. If there's masks and you can get 3 feet, or there's plastic and you can get 3 feet, and you've screened someone so that they're not sneezing and coughing, because that's what really projects the particles. So if I'm sick, which I'm not, but if I was sick and coughing and sneezing, that's where this 6 feet and perhaps beyond would be very important. But if all the kids are screened when they come in, none of them are coughing and sneezing, they're just all well, then the risk of them spreading it, even if they're infected, is much, much less if they wear the masks and they keep that 3 to 6 feet distance. 6 feet is perfect, but 3 feet with these extra barriers, and everyone's masking and everyone's asymptomatic and everyone's gelling, should be adequate. In order to achieve the distancing, you can't pack 30 kids into a small classroom. So if 15 will work, if there's space between the kids with 10 or 15, excuse me, then you have half the kids come in the morning and half the kids come at night. You're not going to be able to have full-time school for everyone. And this hybrid system, many of the schools have actually done really well, where part of it's in person, part of it's online. And I'm just absolutely, I admire the ingenuity that many of the school districts have used to create these hybrid programs. The one thing that you and I have talked about many times is that the kids, if they get infected, won't be sick, so you don't have to worry about the kids. You have to worry about them taking it to the home and infect the parents and the grandparents. So as for those who are over 50, especially over 65, if those kids are going to school, you shouldn't be hugging and kissing them. And I know everyone's going to miss that, but that's the perfect way for you to spread it from the child to you. And what we're learning even more is that most of the kids will have no symptoms. And so all this screening that we do for symptoms, thinking that will exclude coronavirus, we're now learning that it doesn't. And well over half the kids who are testing positive actually have the infection and don't know it. And they're not lying. They're not, if you observe them, and the same is true for adults, but particularly for children, they have no symptoms, no fever, no cough, no congestion, no sore throat. They're just normal. So all of these kids in school who potentially are exposing each other, you can transmit if you're not wearing masks and if you're not distanced, and then that can come to the home. And so for kids, we all will sacrifice a little bit in risk to get the kids back to school. For those that don't want to risk anything, then just locking up at home for the whole family until we get our vaccines is the way to minimize your risk, no doubt. But that takes a great toll on the kids, as you know.
I remember what you told me months ago, and you said if you choose to send the kids back, great, but that means you got to be careful, Grandma, Grandpa.
Yes.
And as I hear you say this, I understand now even more when they talk about this asymptomatic, is that my kids are going to go to school and they wear the mask and then they come home and then want to go play at Grandma and Grandpa's house and they don't have a fever, there's no runny nose, they're not sick, they're totally okay. Okay, kids, let's go to Grandma and Grandpa's for dinner.
Yeah. It won't work. They can be completely asymptomatic and still be contagious. As a matter of fact, a publication just a week or two ago came out from daycare, 1 to 2-year-olds, where one of the daycare workers, her husband was positive. She picked it up, and when her husband tested positive, her partner, I'm assuming then that she let everyone know, and they said, okay, you need to be off work. But it turns out it was too late. She was already contagious, and they tracked kids. The kids, like 30% of the kids in this daycare center picked it up, and they were all asymptomatic. And of those kids that picked it up, they basically infected all of their parents, because your kids at daycare all day long. When you get them back, you're going to hug them and kiss them and squeeze them, and these 1 to 2-year-olds, of course, they don't do a secretion sort of thing, and for a 1-year-old that is a bit too early to put on a mask. So the workers all had masks, but somehow even with masks, they probably picked it up from one of the daycare center employees, and then it spread amongst the kids and then into the home. The parents were also asymptomatic, which surprises me, virtually all of them. So I don't know why that is. I would think that the parents would get a walloping dose of virus and be very symptomatic, but they weren't. But all the kids, the 1 to 2-year-olds, were all asymptomatic. So this just shows, back to your point about grandparents and parents, that your kids, if they go to daycare or to a school, have a chance of picking it up, and then that represents a risk to you.
That's a problem.
It's a problem. And Mother Nature has created the problem. It's nobody's fault. This virus is just insidious. If you wanted to write like a science fiction movie and write about a virus that can spread without anybody knowing it, this is it. The relatives of this coronavirus that make everyone super sick, you can identify those people, you can isolate them, and you can stop an epidemic. This one spreads without our even knowing. And so masks will help limit the spread. And when we get the vaccines, and there will probably be 3 vaccines. When we check the World Health Organization website, 44 vaccines are in development globally. Wow. 44. And they fall into 4 different completely kinds of vaccines. Some of them are just brand new, never been used in humans before. But the vaccines will be out by the end of this year or early next year. I think, Operation Warp Speed is working.
Yes.
So when that happens, then we can start to act as humans to each other again.
Wouldn't that be nice? That seems like a dream, doesn't it?
It'll be so nice.
Speaking of vaccines, Dr. Bradley, we brought this up in the news that there are quite a few Americans now saying that when the vaccine comes out, they wouldn't even get it. I was speaking to a mom who really never got the flu shot for her kids to begin with, and she was told that if her kids would have received the flu vaccine, their bodies would not have been able to fight off COVID. What do we know about flu? Because we've been talking about the twindemic. I think that's what the thing is coming up into this season. And is it safe to get the flu vaccine knowing that COVID and both are coming our way?
Yes. The answer to all 3 of your questions is yes. You should get the vaccine. The vaccine, the shot, is just purified bits and pieces of the vaccine, of the virus. Hemagglutinin and a neuraminidase, highly purified. Same vaccine we've had. So it doesn't alter your immune system at all. So it will make you no more susceptible, no more resistant to coronavirus. It's to the coronavirus, it doesn't know if you've had the flu vaccine. The flu virus will know because you'll be ready to fight it if it should land on you and expose you. So there's no reason that you should postpone getting a flu vaccine this year. You should get it. And we're urging everyone to get it because if for instance, you pick up flu from a business or a restaurant or a grocery store, and you get sick and you have fever and a cough and a sore throat, what are you going to think? The first thing you're going to think is, oh my God, I've got COVID. And you're going to go to your doctor or clinic and you're going to go, I feel really sick, and they're going to test you for both.
Is it possible to get both this season?
Theoretically, you could, and we know with kids, dual infections are actually pretty common, especially in daycares. And we don't have vaccines for most of those viruses, but there's plenty of data to show you can get 2 at the same time. And we know that if you get 2 viruses at the same time, you're way sicker than if you get one or the other separately. So if you get the vaccine, you won't have to worry about getting the flu, assuming that the vaccine is matched with the strains of flu that are circulating this year, which we never know until it circulates. Mm-hmm. So it's a way to reassure you and to not worry about your kids if they get immunized, because they won't get the flu. And so if they get a cough and a cold and a headache and fever, it's more likely to be coronavirus. And so you need to worry more. It's just, if you give them the flu vaccine, one less thing you have to worry about as a parent for your kids.
We are entering holiday season. Halloween is one of my favorite holidays for the kids. Then we have Thanksgiving and Christmas. And you could just see that people are tired, Dr. Bradley. They're they want to be around.
I'm tired too, Sally.
I know.
And Halloween is probably the most fun holiday. And the kids just enjoy it, and the parents look the other way while the kids all get their sugar high from the candy, and it's like, okay, it's Halloween, you can do it. So, but it represents a risk this year. And let me walk you through this, because there are ways to decrease risk, but if you want to eliminate risk, extra risk, then we should just postpone trick-or-treating next year. I'm going to give double portions to everyone. So when your kid goes up to a house, you don't know if they've got coronavirus and they're actively shedding, even if they're asymptomatic. So every house you go to, it's a risk to you. Every person, I love to hand out candy. I just see those costumes and the little kids saying trick or treat. But if one of those kids sneezes at me, and even with a mask, masks are really good, but they're not 100% effective, I could get coronavirus. So my wife and I, as much as we love giving out candy, that this year represents a real risk to us. And our hospital is coming up with little signs to say, we're so sorry, we're trying to decrease risk for coronavirus this year. We'll see you next year, stay healthy, in case someone does come up to the door. We actually, for the neighbors in our neighborhood, we bought candy and we're going to put it in little bags and walk it over before Halloween so that the parents can give them some candy, at least something. One of the recommendations on the state's website is that you pre-package bags and you put it out on the curb. And while that decreases the interaction between you and the trick-or-treater, if your kid's picking up a bag, you don't know that the people like me who are putting it together aren't infected, and there's virus on the bag and on each piece of candy that I put in the bag. And if you're willing, and this is so funny, if you're willing to just let it sit in the bag for 3 or 4 days, then whatever virus is there will die. But have you ever had a child who has a bag of candy and you go, can't touch it for 3 to 5 days? They'll go crazy. So I think while that's a safer option, it's still not as safe as not handing out candy. Does that make sense?
It does. I mean, I'm not taking the risk this year. It's one Halloween. I'm creating a haunted house inside of my house, and I'm bringing extra candy for I'm going to make it so that they don't even realize they're in a pandemic. This will be the coolest Halloween ever this year.
Could you take pictures of that and show us?
Absolutely. Because what I'm learning, Dr. Bradley, the more I come and I talk to you, and the more that I listen to doctors and scientists, I realize that a lot of it is deciding what risks you're willing to take.
Yes.
Who you are around, who you are willing to expose around you, and this asymptomatic that we've been talking about since day one.
Yes.
This is what worries me more than all of this. It's this. I never forget when you told me you cannot look at someone and know if they have this virus. That was a game changer when you told me that.
And I started out thinking it wasn't possible, and I apologize to you and everyone who listens to you that I would never have believed that there's a virus that could do that. And I'm sure Dr. Fauci's never seen this either. And I've been in infectious diseases for 40 years, and this is the first virus that we've ever recognized that can spread with no symptoms. No symptoms, Shally. No symptoms. So anyone that you see could be contagious. So one other piece of that asymptomatic part that I think hasn't gotten out to the population in general, especially for high school and college students and the young 20 to 29-year-old age group, is that if you don't wear your mask and you're out there partying, you can be completely asymptomatic and all your friends can be asymptomatic. And you're fooling yourself if you think you're not putting yourself at risk or everyone else at risk. And if you look at the statistics in our county, it's the 20 to 29-year-old age group, followed closely by the 10 to 19-year-old age group, that are the highest group that are being infected. And they're the group that actually does very well with the infection. They're not dying. And our statistics show those are the highest group for getting the infection, but it's the older folks and those with underlying conditions that are the ones that are that are dying. So if there's some way we could get to these young people that you're putting yourself at risk and your friends at risk if you get together and party with no masks, that would be a powerful statement. In Wisconsin, where their governor tried to do a stay-at-home law, their Supreme Court said, nope, you don't have the power to do that. And so all the masking and stuff is voluntary. So many people don't wear masks. Colleges are back, and these young people are picking up all these infections. And when they were asked by the CDC, why didn't you wear a mask? And some of them said, well, I didn't think I had to. None of my friends are really getting sick. I go on the internet and some people say masks help, some people say masks are worse. All this misinformation. And when they ask, who do you go to for trusted information? There's no central truth that spreads down in our country and states. I'm grateful that we're in California and we have one of the best unified policies in the entire United States. But I can see why people get misinformation and they may really not think that the masks will help. And they do help. So, Shally, if you can help get the word out.
I'm trying.
I know you are, but you have way more influence than I do.
Well, we're just taking the messages from the people who study this and know this to say that using a blow dryer and hot heat does not kill the virus if you blow it in your mouth, which was, in all seriousness, this was the misinformation that people would call me and say, Shally, did you know that would kill the virus, is to put a blow dryer and blow hot air, or to gargle water every 5 minutes. It will kill the virus. It'll wash it down the stomach. But the transition that we've come from that to today, it does seem, even though there are maybe a small population in California who's not abiding, it seems like, Dr. Bradley, people are getting on this train now.
Yes, and actually if you look at the San Diego numbers, which I looked at this morning, the number of outbreaks in our county is slowly dropping.
And I want to ask you about that.
Yeah.
Because every day in the news we report the numbers. And one of the last lines that I read is that a new community outbreak was reported at a restaurant, a business, or a household.
Yes. So last week there were 3 businesses, 3 restaurants, and a restaurant bar.
Yes.
Yeah, and 1 healthcare facility. I don't know what that is, but
how does it spread in then a restaurant? Like, I get the family. You go home, you feel safe, you take this off.
Yeah, people aren't putting on their masks, or someone. You take off your mask when you eat, right? And so, if you cough or sneeze while you're eating, whoever on the next table can get infected. And what the health department does, once you're diagnosed with infection by the swabs, they'll go, okay, where have you been? And they'll go, well, I went to the grocery store, I went to this restaurant, blah, blah, blah. And they track all those places you've been. And then they ask other people who test positive, and bingo, you get 4 or 5 people who all were at the restaurant on this one day. And so something happened in that restaurant. And the health department may not know exactly what that was, but they know that that's where everyone picked it up. And of course, you go and ask at the restaurant, gee, was everyone wearing masks? And of course, everyone was wearing masks, and everyone was well. But now that we know that you can be contagious and feel well, all these people are coming into work, and they're all supposed to be wearing masks. We've been to restaurants, and you see people taking their masks off every once in a while, and so you get someone in the restaurant who's infected, and they spread. Bars. Once you start drinking alcohol, then the filters on what you need to do for public health just evaporate.
Absolutely.
And we know that if you speak loudly, and laugh and sing, that you project your virus way more than just your regular 6 feet.
So this is going to bring me to one of my final questions, and then if you have any other information you want to add, please feel free. On the heels now of Thanksgiving, and we talk about, you were just mentioning our parents and in a time that you want to be with family, and when my kids went back to school, my dad says, so what does that mean for me?
Yeah.
And without even me getting emotional right now, I could feel the sadness because he's alone. I thought of you, and I ask you now to share what you've shared with me and with people that are weighing what to do this holiday season. What do we do when we want to be around our family and even our elders, which we know this virus affects more than just the elders. We know that, but primarily for them. Some of them have a broken heart.
Yes.
So what do you do during this time when you want to love on people as well?
I think everyone understands the risk. Everyone understands the risk. So your father knows that if he comes to your house and no one wears masks, he stands a risk of picking it up from one of your kids. And he knows that, and you know that. And that's, and I have kids in San Diego, and grandkids, and so I'm not going to celebrate Thanksgiving at their house with indoors without a mask. If we have something, it could be outdoors, a sort of noon, early afternoon celebration, and my wife and I will be 6 feet apart with our masks down, eating turkey or whatever, and the kids will be distanced from us, and the kids already know that there's something that they shouldn't be doing with the grandparents. They sense that, and I don't think that they're going to love your father any less because you're protecting him by not having your kids hug him and kiss him. And it's almost harder on him than it is on your kids.
I agree.
But how bad would you feel if he got sick and ended up in the hospital? And I don't know what his age is or other health characteristics, but the older you are, the higher the mortality is, 10, 20, 30%. And if you just wouldn't want to live with that because it's preventable, just preventing exposure. And your father is on the priority list when the vaccines come out to be one of the first in line.
So when is this all going to be over?
Okay.
That's my final question. When is this all going to be over?
Next year, and probably earlier than later. The key, as we've been discussing, is to get people immunized. And as I mentioned, 44 vaccines globally, 3 in the United States are right at that finish line, enrolling 30,000 patients. So these aren't trivial trials. And the FDA told all the companies, look, this vaccine's got to be safe and effective. This is our high bar. If you make this and all your data are clean and it looks like it's going to work, we'll give you emergency use authorization. This Operation Warp Speed has already paid companies, these 3 top companies, to make 100 million doses of vaccine. So even before approval, and this has never happened before, even before approval, these vaccines are being manufactured, put in vials, put on a loading dock somewhere at their factory to be shipped out as soon as the FDA gives the green light. So once the green light is given, then there will be basically 100 million doses of vaccine shipped out within that month. And right now, the state of California has a vaccine priority distribution schedule, just came out last week, and anyone can look at it. and it says, okay, when we get the vaccine, we're distributing it to these places, these places, these places. These are the priority people. We want everyone to figure out a plan for safely delivering vaccine. We don't want crowds. We want people to come in and be distanced and to have this all be perhaps scheduled so that there's no risk of picking up coronavirus when you come to get your vaccine. And so every healthcare institution, including Rady Children's, is working on the plans for providing vaccine once it gets approved. And again, there's 3 companies, not just one. And we don't know which one, if any, or all will be approved until the data are collected, locked down, analyzed by smart people, and the vaccines won't be approved. And we're very lucky for the state of California to look at which vaccines we're going to try and distribute fastest, which are the safest and most effective. There's a panel of 12 scientists and physicians. Mark Sawyer from our hospital, my colleague of 32 years here, is on that panel, and he's going to pick the safest and most effective vaccine for us all, Shali. So I suspect you'll be getting your vaccine probably January, February, because you're out there. That's part of your job, to be exposed, even though you're very young. But your father will be at the top of the list, so he may well get the vaccine before you do. Nothing personal, but he's the one that has the risk.
Yeah, let's give it to them.
So when will it be over? When people get immunized and we know that the vaccine works, and herd immunity, as we've been discussing, when 60 to 70% of the population is immunized or has the infection, and right now there's only like 3% that are infected. When we get to 60 to 70%, the virus will stop circulating as freely as it does now. We're hoping.
Anything else, Dr. Bradley?
I wrote a list of things.
I love lists of things. Tell me what we missed.
I'm a list maker. The only thing that we didn't cover, amazingly, is the long-term consequences to people who just have mild infection. So we know that for many young adults, you just get a cold, maybe lose your sense of taste and smell for a while, and you don't get sick. You don't make it to the hospital. You're not that sick. You don't need oxygen. But when you look at these people long-term, 3, 6, 12 weeks later, they're still not feeling well. They're not back to normal. And we don't understand why that is. We think it's probably some immunologic, rheumatologic reaction to the virus. So it's not like a simple cold where you get it, you get over it, and the next week you're back to normal. For some people, this one hangs on. And we're learning more and more about that as we test more and we identify more people, and the tracking and tracing is much better. We can ask those people a month later, are you back to normal? Are you feeling well? And a surprising number of people aren't. So for the young people who have mild disease and think, well, I'm not hospitalized, there's another complication that they have to worry about, that you just don't feel the energy and the wellness for weeks after the infection that is characteristic of the other respiratory viruses. This is new about this virus. So that's the only other thing that you didn't touch on. Everything else.
Well, and I thought about it because we've heard just people who've been infected that afterwards, weeks, sometimes even months, they just don't feel the same.
Right. And for the older adults, they're calling them the long haulers.
Yes.
Where you're in it. You know, you don't tell someone, you're going to be back to normal next week like we usually do. It's like you're in it for the next couple of months. Don't expect to get back to your work or your job or caring for your kids or your grandkids. And you're not contagious. The virus is gone. These are the after effects of the virus that we don't understand. So much we don't understand about
But you'll
this.
figure it out. You'll figure it out.
There are so many people
There's
working
so
on
much,
it.
yeah.
Absolutely.
They just need time.
They do.
Yeah.
They do. And I'm every week there are thousands of papers that are being published, and many of them are spectacular and quite good. And we're learning more and more about this virus every day. And just about the time that everyone gets vaccinated and it goes away, we'll really understand it.
That's the way it works.
Yeah.
Perfect. Thank you, Dr. Bradley.
Thanks, Shali.
You've been listening to It Is What It Is with Shali Rady. You can join in and ask your questions live on Shali's Facebook or Instagram page. You can find so much more by following Shali on Facebook, Instagram, Twitter, YouTube, and by visiting shalD.com.